The following podcast is taken from a live broadcast on Inspire FM.
Any health advice given, whether general, diet, physical or spiritual, is general only and must be verified by your doctor. If you need medical advice, please consult a doctor.
Assalamu alaikum to all the listeners and viewers. I welcome you all to another exciting and educating edition of the Health and Fitness Show. I'm your host Fahad Matin, and I hope and pray that all of us are fit and healthy by the grace of Almighty Allah. I do pray that we all had a nice and positive week so far and looking forward for a nice and relaxing weekend. This program is broadcasting live today from the studios of Inspire FM on 24th of November or 24th of October 2019. And I'm a bit slightly running late. Unfortunately got stuck in the traffic. We are doing this show live today, and we are casting our positive vibes to all our lovely people in Luton and all the people surrounding Luton, like Dunstable, Harpenden, Bedford, and definitely going our airwaves going all the way from east to west, north to south. Using our Facebook app, using our Inspire FM web app and website and Facebook. And you can also view us live on Facebook. All you have to do is just go to the Facebook page and click our live link. If you're listening this show on Sunday or any other Thursday, that means it's to beat. But hey ho, today is not. It's 24th of October 2019. So hence we are live today. So before we start the show, we normally have information about what the show is all about. So the topic of the show is very unique in a way that we are talking about lung health, and I'm almost catching my breath because I was running from my car. And the person who's better runner than me, it's not other than my guest, which is who's our resident doctor, and he is Dr Talib Abubakr. Assalamu alaikum, Dr. Saab.
Wa alaikum salam.
How are you, sir?
Not as breathless as you.
Exactly. It seems like I need to join your Saturday run, isn't it?
I think so, yes. I'm sure we'll talk about that later.
Definitely, because I was grilled today about that. So if you have any questions or queries regarding our show tonight, please do give us a call on 01582 481822. I repeat, 01582 481822, or you can text us or WhatsApp on 07779 481822. And obviously you can still message us on our Facebook page, which is, if you go to Inspire FM Facebook page, you can see us going live. So, as I said, we are talking about lung health. So, when we say lung health, what is lung health? So, as we know, lungs are our respiratory organs, and they are the best source who can keep us alive in many different ways. But definitely, as I said, I'm not the expert to talk about this. We have Dr. Abubakr, who will be talking about lungs and lung health. So, sir, over to you. So basically, when we talk about lung and lung health, what do we mean by lung health?
Well, we can look at it in lots of different ways. I think one of the most important things to realise is most of us have done fasting in our lives. You can go without food for a few weeks at a time. You can go without water for a few days before you really struggle, and guess how long you can last without oxygen.
Yep.
I think the world record's something like 23 minutes to hold your breath.
Whoa.
I'll be very surprised if we can hold for more than 30 seconds.
Exactly, indeed.
But so you need oxygen, and the way you get oxygen into your lungs is by breathing.
Mm-hmm.
So you need to keep your lungs healthy. So how do we keep our lungs healthy is by everything you do in your show, really, is cover all the things that keep us healthy.
Mm-hmm.
So hopefully we can cover a few things specifically to lung throughout this show to see what we can do to keep our lungs healthy, but also to see what we should avoid doing to make them unhealthy, which is probably more important.
Exactly, indeed, because running is definitely not one of them, and I must say I need to start working on my running as well. But when we talk about lungs and when we talk about lung health, one of the things which we normally talk about is the conditions, common conditions which affect our lungs. So if I ask you to put some light on what are the common conditions of lungs which we normally see?
So at this time of year, obviously, things like coughs and colds, so infections, 90% of them are virus infections. So we're certainly seeing the numbers picking up through the surgeries now. One of the important things to remember is viruses don't respond to antibiotics. So for most people, including children, it's best to try and clear it up yourself without the need of antibiotics. So you'll have a bit of a cough, slight shortness of breath, slight temperature. Treat that with paracetamol, drink plenty, and let nature take its course. There's lots of evidence now suggesting that your body immune system will cope with most things. It will also respond much quicker the next time you get exposed to that virus. Whereas if you keep jumping on with antibiotics, you run the risk of the antibiotics giving you side effects, the antibiotics becoming resistant, and also the fact that your immune system doesn't learn to fight things off itself. Having said that, some people do need antibiotics. About 10% infections are bacterial, and people can still treat bacterial by themselves. The immune system is very strong at treating these things, but sometimes it does get worse. So you need to know what to look out for when you need help, where you feel that your own immune system is not coping with it. 111 is a very good number to ring. I certainly encourage people to ring 111 because they can go through a set of questions to ask, whether it's a child, elderly, or middle age, it doesn't really matter. You can ask them and they will go through the symptoms, and if they feel your symptoms warrant needing a doctor to have a look, they will then refer you on. So that's respiratory infections. Then the next most common thing we often hear about is asthma, and I know you've done many shows on asthma. So that's making sure that children who have a cough that's persisting or wheeziness, family history of eczema, family history of asthma, family history of nasal blockage all the time, they may need to be assessed by their doctors about whether they've got asthma or not. And then people who do have asthma, just make sure you're using your inhalers correctly, go for your yearly checks. And then other conditions, COPD, TB, and also more rarely but significant other is lung cancer. So they're the main ones. There are other rarer causes like fibrosis and so forth, which we do see, but in general public they're quite small numbers.
So when we talk about cold weather especially, one of the common things which we also see is cough, cold, which you just touched. How it is how we can differentiate between chronic cough and the cough which is like kind of a symptomatic, which leads to long-term conditions or something like that.
Okay, the way to look at that is what's the purpose of a cough? The cough is a defense mechanism. It's your body trying to get rid of things that shouldn't be going into your lungs. So it's very powerful. You can't stop it without using lots of powerful drugs. it's a natural response to any form of infection. So your body reacts by producing mucus to fight the infection. That has white cells to fight the infection. And to stop those white cells collecting in your lungs, your body coughs. And what a cough is, an automatic reflex where the diaphragm flicks very fast and then makes you cough. So there's very few medications we can give to actually stop cough. And in fact, the cough is protecting you, stopping you getting pneumonia because it stops the phlegm. Your question is really good, because how do you know what's a serious cough and what's not a serious cough?
Because as soon as we start coughing, or especially kids when they start coughing, or elders, you automatically say, it's not good. And the first thing people do is to go for cough syrup or lozenges and something like that. So that... so sorry.
So with cough, the important difference is if a cough is there, if it's a virus, it's going to last a few days. It may take up to 3 or 4 weeks. Okay. With the bacteria, the cough will get worse, but the person themselves will start to feel worse. So after 4 or 5 days, their temperature will still be coming up. They won't respond to paracetamol. They'll start to bring up much more phlegm. Their phlegm will start to become green, and also they'll start to get short of breath. So if that's happening, then we probably need to seek help. And again, I would ring 111 to see whether they fit the algorithm to be seen by a doctor. If you're that worried, then obviously make an appointment with your doctor. If the phlegm's fairly clear and it's more of a tickly dry cough, then you've got a bit more time to allow nature to take its course, because that cough is protecting you. It is stopping the phlegm collecting in your lungs, and avoiding pneumonia. But if it's persisting, and I would normally say 6 weeks, the posters all say 3 weeks, particularly if you're a smoker. If it's lasting more than 3 weeks, you should be seeing a doctor. If you're a non-smoker, I think you've got about 4 to 6 weeks. As long as you're not short of breath when you're doing things, and your temperature comes down with paracetamol.
Okay. Sorry.
Yeah, and any cough with blood, you probably need to go and see a doctor. Because we would need to check your chest and organise a chest x-ray if needed. The commonest cause of blood in your cough is when you cough too much and you've burst a little blood vessel in the back of your throat. But obviously if you're a smoker or anything like that, we need to rule out other causes like bronchiectasis, COPD and lung cancer.
And when we say smoker is like both having a normal conventional cigarette as well as the e-cigarette, or now known as vapes.
Not quite. The cigarette smoking is by far more dangerous, because with cigarette smoking, it's not just nicotine. You got obviously the heat from the cigarette itself. You got nicotine. You got all sorts of other fantastic chemicals that we put in car fumes, that we embalm bodies with. So formaldehyde, tar, all sorts of that. At least 40 different chemicals that can cause cancers, and I think you've had the smoke cessation team here before going through all of that with you. I often say to my patients, if I was walking down the street and stood in a traffic jam and I said to you, Fahad, hang on a sec, let me just go to see that car, and took a big inhalation of smoke from the car exhaust, there's actually more different types of chemicals in cigarette smoking than there are in that exhaust pipe. Obviously the volumes are slightly different. So cigarette smoking by far is the most damaging thing that you can do for your lung. Vaping is just nicotine with heat. If you went to your kettle that's just boiled and inhaled that, do you think that's doing damage to your lungs?
Yes, definitely.
That's just steam, that's just water. Yeah. So vaping is better than smoking, but it's still not 100%. There are some studies, there was one particular paper suggested it was 95% better than cigarette smoking, and I agree with that. It's definitely better than cigarette smoking. I would rather have someone vaping than cigarette smoking, or cigar smoking, or sheesh smoking. I would rather them vape the electronic cigarette cigars, or whatever they call the e-cigars. The problem with them is the long-term studies aren't there. So there are reports of people becoming ill with them. I think there was one death possibly associated with it in America. We're not seeing that so much in this country. But what I say to people, and I think I've used this analogy before, but it's quite a good one, so I'm not ashamed to repeat it. But it's like driving a car on the motorway. You drive 70 miles per hour. I do everything right. I can't guarantee I'm not going to have an accident. Cigarette smoking, you're increasing your risk by 5 times. So what you're actually doing is driving your car 350 miles per hour. Well, guess what? Your chance of having an accident is sky high with that. So things like cancer, COPD, all sorts of mouth cancers, bowel cancers, bladder cancers, all been linked with cigarette smoking. Your risk of strokes go sky high. With e-cigarettes, let's, for analogy's sake, and it is probably about driving about 100 miles per hour. So it's not ideal, but still better than driving 350 miles per hour. And the mistake people are making with e-cigarettes, and some of the research studies are suggesting this, is that people tend to they see it as a way of giving up cigarettes, but tend to stay on e-cigarettes for longer because they think it's safer, so they can carry on. What they should be doing is to try and use it as a way of coming off nicotine altogether. So cigarettes are very addictive, so you go onto your e-cigarettes or your patches or your medication and see the smoke cessation teams in your practices or through Luton Total Wellbeing. If that's not working, you go onto your e-cigarettes, but the idea is to slowly cut down over a period of time. The mistake people are making is they're staying on it, and that's when you increase your risk of damage to your lungs.
Okay, Doc, what can people do to keep healthier lungs? Well, now we have talked about the common conditions of lungs, and one of the things which we do need is a healthier lung. And as you just mentioned about the side effects of cigarettes and cigarette smoking, what else we can do to keep our lungs healthy?
Well, smoking is by far the biggest. Yeah, there's just no doubt whatsoever. For children, don't smoke in front of your children. It's not good for them, the inhalation of the smoke. So if you're going to smoke outside. Ideally, don't smoke at all in front of them. When they see you're stressed, most people smoke more when they're stressed. You don't want to be teaching your children that the way you deal with stress is by going to your cigarette. And they'll learn from your parents. Parents, it's not just what you say to them, it's what you do. They learn more from what you do than what you say to them. And you can see your children are little me's or little mums or little dads. They just follow what you do.
Indeed.
So they know whether you smoke or not. People can smell it on you and what have you. But the more they see you smoking at particular times, they're going to think that's what's associated. As they get older, they will start to mimic those habits. Okay, so that's really important. Other ways of looking after your health is exercise. Exercise helps with your lungs aren't muscles, but they literally work like muscles. So the more you work them and the better you work them, the more efficient they become in exchanging oxygen into your blood system. So that improves your diaphragm, improves the intake of your breathing. Breathing properly is important. So if I was to ask you to take a deep breath in now, most people's stomach would go in. Now, if I give you a small physiology lesson, how you get air into your lungs is by your diaphragm going down, which then makes a vacuum which sucks the air in. Where if your diaphragm goes down, that means the stomach contents gets pushed out, so your tummy should come out as the diaphragm goes down. Most adults do it the opposite way around. We take a deep breath as stomachs go in, which then doesn't allow the diaphragm to come down, so you're getting about 10 to 15% less oxygen. So just by breathing properly, so as you breathe out, you push your stomach in. As you breathe in, you push your stomach out. And things like yoga and things like that, yoga breathing, shows that. If you watch a child, 2-year-old or 3-year-old breathing, you'll always see their stomach coming in and out. It comes in when they breathe out, it goes out when they breathe in, which expands the lungs better. So that's a good practice to do. It's really good for relaxation, so people with anxiety and things to do cyclical breathing where they take a deep breath in, make sure their stomach's coming out, do it nice and slowly over 3-4 seconds, hold it for 3-4 seconds and then breathe out for 3-4 seconds. And do that for a few minutes, a few times a day, and you'll be surprised how much healthier you will feel, how much calmer you will feel, and how much better you will feel. So that's exercise. Obviously, eating healthy is important. Eating healthy, your antioxidants in lots of vegetables, green vegetables and things like that, helps the oxygenation process and helps get rid of toxins that poison your body. it also means that your weight is probably likely to be balanced as well. And again, I've said this on your show many times before, but if I was to pick up one of these chairs, probably about 6-7 kilos, I'm probably about 7 kilos overweight. I probably need to lose a bit more, so probably I'm about 4 kilos overweight. Some people are 7 or 8, 10 kilos overweight. That's like two chairs. No need to wait for me, Fahad. But that's 2 chairs. Now imagine carrying these 2 chairs with you 24 hours a day, 7 days a week. How breathless are you going to feel?
Well, you just witnessed that. You just literally
I've never seen you run so fast, Fahad. That was really good. But if you got rid of that chair, even one chair would make a big difference to your shortness of breath. And this goes for people with high blood pressure, diabetes, asthma, COPD, heart failure. Breathlessness is made because of the condition you've got, but it's added on to by your weight.
Mm-hmm.
So if you're not your ideal weight, you're going to be carrying extra on a lung that's already damaged.
Mm-hmm.
You're not giving it a chance.
Exactly.
So exercise, watching your diet is really important.
Mm-hmm.
For those with conditions, one of the biggest problems we have is people don't use their inhalers properly.
Mm-hmm.
Either they don't use the preventative ones, like the brown ones, which again you've mentioned many times in your shows.
Mm-hmm.
We need to make sure that you don't just use the blue inhaler, people with asthma. The blue inhaler is very good at opening up your airways, but it doesn't stop the inflammation that closes them back.
Mm-hmm.
And it's the inflammation that causes the damage. So it's really important that we're using inhalers. And if you're not sure, get your asthma checked.
Mm-hmm.
Go to the practice and book your asthma review.
Okay. Wow, I must say it is really, really inside, and definitely exercise do help. And unfortunately, we're just literally running out of time, and we are about to go for a break. But when we come back from the break, I do like to touch on that. Plus, I also want to touch on the basis of screening services for lungs, as well as flu vaccinations, because it is a flu season as well. And what sort of a lung health screening we can do, and who can do it, and what we need to look after, what age it requires, and so forth. So all these things will come back after the break, and definitely we will touch bases on flu as well when we come back. So stay tuned. We will be right back after these short messages.
You're listening to an Inspire FM podcast, making available our popular programs from our daily broadcast on Inspire FM.
Any health advice given, whether general, diet, physical, or spiritual, is general only and must be verified by your doctor. If you need medical advice, please consult a doctor.
Assalamu alaikum and welcome back to the Health and Fitness Show. I'm your host Fahad Matin for today's show, and I hope and pray that all of us are fit and healthy by the grace of Almighty Allah. So before we went on break, we were talking about lung health, and it is a topic where we were talking about how we keep our health, our lungs healthy and fit, and definitely we have talked about it in details regarding that section, and we wanted to scope a bit more about it. And when we and on this part of the show, we will talk in detail about how to keep our lung healthy. Not only that, how to keep it in check. This program is broadcasting live from the studios of Inspire FM today on 24th of October 2019. And definitely we are live now, and our airwaves going all across Luton and the surrounding areas of Luton. So, as I said earlier, before we went on break, we were talking about lung health, and we wanted to continue that topic. And the best person to talk about this topic is none other than our residential GP, Dr Talib Abubakr. Assalamu sir.
Walaikum.
So before we went on break, we were talking about how to keep our lung healthier and what we can do, and you have given perfect examples. Now, on this side of the show, I want to concentrate on lung screening, or as in how we can get the screening done, who will require to get a screening, and why and when and how. So I need to ask all these questions, but there are so many questions. So the best person who can answer all these questions is yourself. So let's talk about who need lung screening firstly.
Well, screening in Luton is like a lot of national programs. There's lots of different types of screening. There's breast screening, there's bowel screening, there's cervical screening. One of the problems we have in Luton is that compared to the rest of the country, people aren't coming forward. We don't know whether that's because we in the health profession aren't advertising as well. People are ignoring letters that they're getting, and some of the studies are suggesting that people are a bit frightened about what it might be. They don't like the way the screening is done, perhaps, or they feel that it won't happen to me, and it just happens to other people. So if we look at some of the figures which I've got written down here, if we look at Luton in terms of breast screening, for example, we're not too bad compared to the country, but just under 70%. The rest of the country is 72%. So people seem to be more frightened of breast, but still only 70%. So that means 30% of people aren't getting the screening that they need to do. Bowel screening is a little poo sample. They've made it very easier now. It's between the age of 60 and 75. It's just a little poo sample onto a piece of paper that you then send off in a little pack. We're 50% of potential numbers that we could be screening, and the number of patients I've got who've had their lives saved because that poo sample has picked up something, and then they end up having necessary procedures, which then picks up things early before they turn into something nasty. So it saves lives. Cervical screening, it's improved, but we're still 65% compared to 79% in the rest of the country. So we are poor with that. And when we look at lung health, the particular thing that we're being concerned about across the country is that we're picking up lung cancer at too late of a stage. Cancers are staged into 1, 2, 3, 4, and 3s and 4s are not good news. So if you look at lung cancer, your survival rate is less than 10%. I think it's less than 5% actually if you picked up at stage 4. Because of this, the government had looked around the world, and places like Japan have been doing screening of lungs for many years, and they've noticed that people are being picked up because of screening at stage 1. Okay, most people who get screened have no cancer, have no problems, but we're picking up those few at a much earlier stage. If you come to me as a doctor and you've got a cough and you're coughing up blood and you're a smoker, you're going to get a chest x-ray, and we will organise a chest x-ray, and that may or may not show a cancer. For most people, fortunately, it's clear, but as I mentioned before, your risk is 5 times higher. What they found was that if we actually, for those at highest risk, so that's those people who are smokers, who've smoked for a long time, who've got breathlessness, who've got various answers to a questionnaire that we would do. If we do a low emission CT scan, we're picking cancers up at much earlier stages, even before x-rays can pick it up. And for those, we're picking out at stage 1, which means they're almost curative. So majority of those would be curative. So you're saving people's lives. People are being picked up at much younger age, who can still be with their families, grandchildren and so forth, and do all the things. So patients of mine who've had cancer picked up at an early stage are still alive, who can still enjoy their time with their families and live a full life. I've got one chap here in his 80s who's still working, who was picked up with cancer about 10 years ago. So it's incredibly powerful. So what the government have decided to do, they piloted in Leeds and Manchester to see whether we can catch up with Japan. So what they did with anyone who smoked, who are now aged between age 55 and 75, ever smoked or still smoking, they would get a questionnaire. And with that questionnaire would ask lots of different questions to see what their risk was. And if their risk was even higher on those questionnaires, they would then get a low emission CT scan, which picked up an extra 100 cancers at much earlier stages.
Wow.
So you're curing these people who would have gone on to have cancer at later stages. So we've been fortunate in Luton that we're the next tranche in this pilot study. So we've been picked from with 10 other areas. One of the reasons we picked because we've got high ratio of smokers and high ratio of cancers and cancers that are being picked up late. So it's not all good news, but it is good news because they're investing a lot of money for us to do this. My concern is when you look at other screening, we're poor uptakers. So I'm hoping, and one of the reasons I'm here today is to remind people that if you do get a letter, and hopefully we're going to start this off in January, February time, if you get a letter asking about lung screening, don't be scared about it. It's about reminding you about how to look after your lungs, and there'll be a number to phone. When you phone that number, they will then ask you the questions, and if they feel that you tick the right boxes or the wrong boxes, we can then offer you a scan. The scan, majority of people in even the pilots have normal scan results. It may pick up other things like COPD and things like that and fibrosis, but the cancers pick up still very small. But in the studies in Manchester and Leeds, an extra 100 people were picked up at much earlier stages, and these people would have been picked up at later stages. So the idea is to save lives, and I think it's a really good opportunity for us. So what the plan is that come January, February, we've got 4 years to do this. So over the next 2 years, we hope to scan everyone in Luton that's between the age of 55 and 75. Their GPs will be writing to them. There's a project team that will go into the GP practice. So although the GP practices will be involved, it will be the teams that will be sending out the letters to those patients between 55 and 75 who've ever smoked or still smoking. They will get a letter inviting them to phone this number. So it's going to be over the next 2 years, so not everyone's going to get it, but they will get over 2 years. They will get a reminder letter if they don't respond. So the reason I'm coming on so early is just to remind people not to ignore the letter.
So is it just for people who are smokers or ex-smokers, or there are other comorbidities involved?
No, just for the pilots, very strict, because we've got it's because it's still a research project, so you've got a strict guidelines. And that doesn't mean that if you're coughing, bringing out phlegm for 6 to 8 weeks and it's got blood in it, you still go and see your doctor. So the screening is separate from what you would normally do if you still have problems. Screening is very specific for that group of people, because that's where the highest pickup rates have been. And it's been the most cost effective in doing that. So the idea is that we'll try with that group, and then if that seems to be showing the evidence that we need to, then we can expand that to more. And that's how all the screenings have started. So if you look at bowel screening, it started off a very small group and then expanded out to more. So I can only encourage, and I'm sure if you don't mind, I'll come on again at some time closer to the dates that we start to send out these letters in the new year to talk about this further.
Indeed. So in terms of people who already suffer for things like long-term conditions, we normally offer them a flu jab as well. So why... And I know that people who have respiratory conditions or respiratory problems are first in line for that. Any specific reason and why they've been asked to get the flu jab done?
Okay. The way to think of it, is your immune system is like an army. The army is very good at protecting itself against infections, against cancers. It rebuilds parts of the body that has been damaged. So it's constantly doing work. That army needs to be strong, so you need to feed it well, healthy foods, not bad foods. If that army gets distracted by bad foods, or that army has to work harder because someone's got heart disease or had a stroke or lung disease or kidney disease or having chemotherapy or immune compromised, if that army's having to work harder, when that person gets flu, that might be enough to stop that army working. Does that make sense? It's probably too simplistic, but it's, for my simple brain, that actually works quite well. So for most people, flu is just a virus infection that your body will cope with and get rid of. So my army would get rid of it straight away because I don't have any chronic diseases. But if you've got chronic disease like lung disease, heart disease, renal disease, diabetes, strokes, and there's a long list of other things, your immune system, your army, is having to work a lot harder. So if you get flu on top of that, that might be enough to break that army. So what you want to do is protect yourself from getting the common types of flu that are likely to come this year. There's hundreds and hundreds of types of flus. The flu vaccine covers mainly 4 to help your army not have to worry about that. And the evidence is overwhelming. The problem we have now is, you will get odd research saying that it's not effective. And that's what the papers pick up on, that's what social media pick up on, and everyone gets to hear about the negative side. But there's still enough evidence, because if you look at the world, across the world, certainly in America, where litigation and suing is very high, they're still using flu vaccinations because it stops people going into hospital, it's stopping people getting pneumonias, it's stopping people dying. And there's lots of evidence. And if there was any worry about it, they wouldn't expand it to people like pregnancy, children. The numbers of children we do are more now, and they're encouraging us to do more.
And in the schools nowadays, we are in Luton. We are a bit kind of lucky that there are 10 schools in Luton. We are doing a special pilot program where kids will be given injections rather than the nasal flu drops, which has pork gelatin. So they will be giving injections which do not have that, and it's good because it will cater the school going children as well. And if that pilot successfully conducted, then they might think of rolling it out on a bigger scale, including GP surgeries in following years to come.
Yes, I mean that would be really helpful, because all kids go to school, so that's where we're more likely to get hold of them. But what we've tried to do, certainly for flu, is to open it up so your pharmacist can give you flu vaccinations. Your GP practices, most of them will be able to get you appointments fairly quickly to get your flu vaccination, because we all know it's so important. One plug, next week I'll be in the Mall with what we call the mega lungs to try and encourage people to think about their lungs. There'll be a huge 12-foot lungs, inflatable lungs.
To be honest, that's my next question to you.
That'll be there on Friday the 1st, and a lot of the lung specialist teams will be there, so the community teams, the stop smoking teams, health promotion, public health will be there to answer any questions about lung health and perhaps talk about the lung health screening that we're planning to do.
So when is that?
That's all day Friday, the 1st of November.
1st of November, okay.
I'm going to be there from about 3 o'clock.
Okay. And whereabouts in the mall?
I'm not sure. Good question. I think it's right by the right in the centre.
Where the reception desk is?
I think so. Yes.
Okay,
I should know, but I just know it's at the mall. I'll just walk along that main hallway, and you won't be able to miss them.
It will be a really big lung.
Yes. But, I think it's so important, because these rates are still going up. We should be able to pick things up earlier. People are dying of asthma. That shouldn't happen. So people don't know what to do with their asthma. They're not sure whether it's asthma or not. That shouldn't happen. So, I think the more we can talk about these things, Asthma UK website is absolutely fantastic. So if you've got any questions or doubts, it's a very simple website to go through. So, if you've got any doubts about it, have a look at this information. If you're not sure how to use the inhalers, you can look on YouTube and just find your name of your inhaler, and you can find a video on how to use it. By all means, use your practice nurses. Your pharmacists are very good way of actually, they can show you, as part of their role is to show people how to use their inhalers correctly. Because when people have asthma, one of the number one problems, as I mentioned earlier, is that people aren't using their inhalers properly. But yes, 1st of November we'll be there to try and encourage people to talk about their lung health.
Lung health. Okay, so in that event, do they do lung checks as well, or asthma checks as well?
Not for that. That should be set up by the practices. In the lung health screening, if your questionnaire is positive, then we would invite you on. We've got a specially designed bus with specialist nurses going in, asking you more questions, and then we do a spirometry, which some practices already do, but we will do a specific spirometry to check your lung capacity and see if it's putting you into that slightly higher risk, and if need be, then they can go on to the CT scan, which is on the bus as well. So not everyone will get a CT scan because you don't need to, but those who are positive on the questionnaire and then need spirometry, they will then, if they're high risk, they will go onto the bus. So we think if we look at Leeds, we want to outdo Leeds. I think we really want to show off Luton. They all the letters they sent, only 50% responded. Out of those 50%, only 50% of them were thought of as high risk, and out of those 50%, only 100. So out of 50,000, only 100 was picked.
Only 12.5% is the ones who end up in there.
Yeah. So, not everyone needs a scan. So it's not about scanning everyone. It's about picking up those at highest risk so we can offer them a scan.
So people, when you said they had smoke or they smoked or they used to smoke, so what about people who are passive smokers or people who only smoke in like companies?
At the moment, we're only, because that's what the guidelines are for this research pilot, is those who are on their practice list as being smokers or have had smoked.
So people who haven't smoked a smoker list on these surgeries won't be invited?
Not at the moment.
Okay.
Yep. But as I say, it's a small number. I must reiterate, if you've got symptoms of chest problems that we've gone through already, then go and talk to your doctor, because they can still go through the normal pathways.
And definitely we need to lose the weight as well.
I guess so.
In terms of the exercise, I just need to come back on the exercise part. What are the best exercises for lungs?
Breathing is a good one. Breathing properly is even better. Walking. Yoga is fantastic for, and I'm not a yoga person, but I'm planning to get more flexible, but also for the breathing side. But if you can, and running is good. So every Saturday I'll keep banging this drum, but every Saturday morning 9 o'clock, park run. You can register online, park run. This Sunday is Love Luton half marathon around Luton, so I'm running that. There's some CCG people running that. But Team Luton that did the marathon, and a lot of their colleagues, there's about 200 of them, raising money for the food banks. I think it's the Curry food banks, raising money for that. So really good causes. There's about 200 of them running. Most of them have not run before, and they've started and they've put this plan together, and they've started training, and you can see them come. The numbers in parkrun have increased and culminate in doing half marathon in the centre of Luton, through Luton Hoo, back into the centre, and the finish is right by the town hall. So come and encourage us. Would love your support. It's quite hard when you get to about 6-7 miles and you're on your own, so the more people out there the better. But it just shows what people can achieve. So you'll hear lots of stories, and I'm sure you'll see it on social media, these people have been encouraged by the people who did the marathon. 2 years ago, there's 4 of them who did it, and then last year I was part of the 20 that did it. Again, people have lost lots of weight. You'll have heard of Rana Mia, Kudal Ashraf. Both of those, between the two of them, have lost over 20 stones and raised lots of money. Rana reversed his diabetes. He came off his CPAP machine, which is incredible. So, Love Luton half marathon. If you, I'm not sure if you can still apply. The 10k. There's also 10k for those who don't want to do 13 miles. I've unfortunately somehow convinced myself to do 13 miles, so I'm not quite ready for it this year. But I'll
Come
plod
on,
round.
so you're a professional runner. You
I
run
would say.
marathons. Half marathon is like a doodle for you.
I've run a marathon, and I saw the pictures from the marathon, and I looked very bad, but I got done. I did it, and as I say, it's something that I've enjoyed doing. It keeps me healthy, keeps my lungs working properly, keeps my heart pumping well. Doesn't stop my hair greying, but keeps me well.
Well, keep the weight in check as well.
Yes.
Definitely. So we just coming too close to end now. So if I ask you to give a quick update, a quick recap of what we have discussed so far before finish of the day, I will be really thankful to you, sir.
Okay, one of the things we're really blessed with in Luton is something called Luton Total Wellbeing. So part of their remit is anyone who's got depression, anxiety. If you ring 0300 555 4152, 0300 555 4152, you can look it up on the web pages as well, Luton Total Wellbeing. What that is a one-stop number. If you want to stop smoking, you can give them a ring, and they will guide you along the process and actually book your appointments evenings during the week. I believe they've got translation as well. If you want to get fitter and you feel you're overweight and you want to lose weight, again, that's the same number, and they will be able to talk to you about weight management, get you involved with various groups that get together to help you lose weight and get fitter. Those who want to get fitter, you can ring that number, and they will guide you on things like exercise on prescription and things like that. So it's a fantastic number to have. So I'll give it out one more time. Luton Total Wellbeing, 0300 555 4152. Look it up on the website and see all the fantastic things they do. So we're really lucky to have that in Luton. Apart from that, lose weight, stop smoking, do your breathing exercises, go for walks. You know, we're really lucky in Luton. We've got some fantastic parks. If you go to Stockwood Park, go to Wardown Park, it's beautiful. It's really nice to walk around, or go up in the hills. Go 5 minutes anywhere in Luton and you'll get up into hills and countryside, and it's fantastic. We just don't use it, and there's lots of evidence suggesting that if you're in nature, the oxygen that you get, lung health's good. It's good for your mind, it's good for your body.
Okay, perfect. Thank you so much, sir. Many thanks for coming and sharing the wise wisdom, your wisdom with us and our lovely listeners. And thank you so much for giving us such a big good advices. And also, definitely, I will try.
See you 1st of November in the mall if you want to come and chat to us in the Mega Lungs.
I will be there.
Before that is the Luton Half Marathon.
Marathon, I will definitely be cheering on the sidelines. I won't be running in, definitely. But yeah, definitely.
Maybe next year, Fahad.
Maybe next year, inshallah. If you missed any part of the show, don't worry, you can catch up live on Facebook page. Otherwise, we will be back again next week with flu vaccination codes. Until next week, Assalamu alaikum.
Thank you for listening to our podcast. Why not tune in to our live stream at inspirefm.org and follow and subscribe to our social media platforms at Inspire FM Luton.